Hey everyone, welcome to Quick Hits. I'm your host, Sean Piers. We're here with Dental Piers, bringing you another version of Quick Hits. We're always excited to bring you these short educational pieces. And today we have a really exciting and interesting guest, someone that I think a lot of you, if you're not overly active on social media, might not be familiar with our guest today. But she is someone that if you are busy out there on Facebook and on Instagram and stuff like that, this person might be familiar to you. She is a fitness fanatic extraordinaire. I mean, I'm always been one to try to take care of myself, but I'm not going to get into a competition with this guest today on that front. She is a fitness competitor. She is a hygienist, so she has that ability to combine fitness knowledge as well as what goes on in the dental world. She is a passionate speaker on topics of health and wellness in the dental field. I mentioned she's a fitness competitor, right? I got that in there. What more? If you've seen her maybe on her personal page, she also has her business pages under Ergo Fit Life. Welcoming from California, 3 time zones away, Katrina Klein. How are you this morning?
I'm fantastic. Thanks, Sean. I appreciate the offer to come on and talk to you today.
Well, I mean, it's great to have you and hopefully introduce you to some new people up here in Canada that, as I said, if they're not busy on social media, might not have had the chance to meet you and get to know you a little bit, because of course, we can't really easily get down to any place you're speaking in the States in the midst of this silly little pandemic thingy going on.
Yeah, this little thingy.
This little thingy. Yeah, this little thingy. Um,
Yeah.
so but at the same time, I mean, the things that you talk about and educate the dental community on in terms of their own health and wellness has, I think, for years been overlooked, and we're just kind of starting to scratch the surface on it. And what got you into it, and what do you talk about? What do you suggest, and what do you see as being the problems?
Well, wow. So many things. Well, first of all, I've been in dentistry for 24 years. I got in when I was 19 years old. So this is what I know. This is everything I know. And one thing that's been consistent throughout my career is pain. Everybody in dentistry is in pain. And of course, it seems though the longer we are in it, the worse the pain gets. And after practicing hygiene for 10 or 11 years, I noticed I had no pain. And a colleague of mine was working in the operatory next to me after only 2 years, going to the chiropractor 2 times a week, still not getting results, had horrible posture, and of course was in pain. And she said, I don't think I'm going to be able to do hygiene for 5 years. And so I got into bodybuilding, and I noticed that I grew a half an inch, which when you're 5'1", that's a really big deal. My posture had improved through strength training. And, I've always been involved in ergonomics. I had ergonomic training early on through my time with corporate dentistry. So that really helped working for Delta Dental. They're the ones that really don't want you to be putting in workers' comp claims. So they make sure that you are ergonomically sound. And I kind of just combined the two, because when we're in the operatory, the things that we do is really the root of the problem. And then when we don't prevent more issues by doing strength training and stretching and, learning how to make sure that we have balance in our body, it just kind of snowballs until suddenly we're calling me saying, Katrina, I've got 10 years left. I've got a kid in college and I need to finish my career. And that's kind of motivating to me. It made me really want to get in and help people. So that's where I got started. I took a chance. I decided people really needed help, and I continued my education. I got my certified ergonomics assessment specialist initials, which was pretty cool. I am a certified personal trainer now as well. Have been for a while. And I just help people. I mean, I still practice in the mouth 4 days a week. So I understand the struggle of the lip, the tongue, and the cheek. and I know what we go through. So using biomechanics and really good ergonomic strategies seems to help a lot of people. I go out and do assessments in offices with doctors and hygienists. and help them get out of pain, trying to pinpoint exactly what's going wrong in the operatory, and then give them strength exercises and stretches to make it better, and to keep the problem away. So
And
oftentimes we find that people end up in surgery, they get the surgery, they go back to work and cause the same problem to come back just months, years later, because they're doing the same thing that started the problem.
and that's the challenge, right? Let's face it, you're seeing it every day. Like you said, you're still working in the mouth, which, as we know, I mean, even in a big mouth like me, it's still a relatively small area that we're working in. And you got to be hunched over, you're bent over, you're not in what anyone would really consider a natural working position for a long period of time. So I mean, the wear and tear is going to be there, right?
It is, and it can be prevented though. But yeah, the challenge is real. The struggle to maintain neutral posture is exceptionally difficult when your workspace is down below you. So there are issues that seem almost impossible to overcome. They're not, but it is a large bit about mindfulness, mind-body connection, having the muscular integrity to be able to support yourself in neutral posture and maintain it. And then also understanding that there is equipment, there's tools, there's strategies, ways that you can position yourself and your patients so that you don't end up with these MSD chronic pain issues. So that's where all this education and extra time that I spend living, eating, and breathing ergonomics helps out.
And so that's
Yeah.
some of the coaching, I guess, because you said you're a certified ergonomics specialist trainer. I can't remember exactly what the designation was.
Yeah.
So part of your assessment, I mean, obviously the strength and training and the stretching and those sort of things help outside the office, but part of what you also want to do is approach what's going on inside the operatory, correct?
Right. Yeah. When I go out to an office, I literally shadow the doctor for several hours, or the hygienist, and watch every move that they make. I look at the setup of their operatory, how they're sitting in their chair, how the patient is lying back, where everything is at. And it's interesting because people will struggle for years. And kind of a funny side story, that the assessment I most recently performed was for a doctor who has a chair graveyard. He has every dental chair that he could find to try and correct this problem. And it came down to, it wasn't his chair at all. It was how he had his computer set up. It was completely behind him, and the keyboard was up too high, and the monitor wasn't high. It was just a mess. And so having someone to see the space that is being worked in, the way it's being used, and the equipment that's being used makes all of the difference in the world. And I just wish I could have gone back, years ago and stopped it before he had to spend however much money on all of those chairs, which are not inexpensive. So yeah, it's a big deal to have someone come in and look and see what you're doing.
Yeah, that's I mean, I'm just trying to picture that, like something that sounds so simple and routine, just the placement of a computer keyboard.
Yeah.
And
Yeah.
yet you look at it and you see that was the problem.
Right.
I mean, it sounds so minor, so insignificant. How can that be causing an issue? And sure, maybe if you're doing it for 5 to 10 minutes, it wouldn't be an issue, but this is their day, all day, every day.
Right. Right. It's over and over throughout a procedure. A dentist can look up at the monitor, 35 times to make sure, they're looking at roots, they're looking at bone levels, they're looking at, everything. When is the last treatment? Make sure I'm getting the right tooth, whatever the case may be. So, it can be something as simple as that. I mean, that's not the normal circumstance. Usually it's operator positioning and patient positioning that we have to work on a lot. But in this case, it wasn't. And it just goes to show that being in that space makes a difference.
Is your experience then, like when you talk about operator and chair positioning for the patient and everything like that, is it like they're setting the chairs too low? Is it particular chairs may really not be as viable for working in dentistry as you might want to think they are? Like, what do you see as kind of being your number one issue?
I would say the most prominent thing is the operator and how they're positioned. So one thing that we know is that 33% of dentists retire from disability before they're ready to retire age-wise. And that comes from body pain in themselves. And so when you look at body pain, you're looking at how are we staying in neutral or not neutral posture. Well, the patient position is pretty relative. Either they're moving toward you or they're moving against you or they're not moving at all. And that's an easy fix. And most of us know it when we're in the mouth. We can say, oh yes, I'm horrible about making the patient move their head. But what's more difficult is when we work like this, for example, the arm goes up and it sits there for a long period of time. That can wreak havoc on the mouth. Or when we lean forward because we're not using a saddle chair, for example. A saddle chair, it actually programs your body to sit in neutral position. Your spine is not meant to be tucked under sitting on a traditional stool in a position where you're then leaning forward or you can't see. So yeah, it's the patient chair, it's the operator position, it's the loops that they are or aren't wearing. It's the way that they're holding their hand, and if they're putting a death grip on the instruments. It's there's so many factors involved that it's a puzzle.
I saw one of your recent posts with respect to the issue of the death grip on the instruments and everything like that. And it's hard, right? Because I mean, let's face it, sometimes you're working on a patient and it's a challenge. If they haven't been, let's say, a regular patient that be regularly seeing their hygiene team or their dental team, you know, I mean, it can be a little bit of a challenge to basically be able to provide good quality hygiene services without putting a lot of elbow grease into it, shall we say. And
Absolutely.
yeah, so
Yeah.
I mean, how do you compromise between making sure that, okay, I'm providing the good caliber of care and getting the cleaning and getting the debris and everything out of the way that I really need to make sure that this patient's hygiene is being looked after properly, but I'm not going to be doing it in a way that compromises my health.
So, you know, it's interesting that you immediately jump to hygiene. And I would say that that's probably the most common complaint, because hygienists, you know, our hands take the brunt of a lot of what we do. And for hygienists, it's actually fairly simple. It's use mechanized scaling. You know, we need to use ultrasonic scalers and piezos or whatever mechanized scaling is preferred there, but that's what those instruments are for, is so that we can get the bulk of the debris off of the teeth and then use our scalers to go back through and do fine scaling. Because at those points, we find that we're not putting a death grip on the instrument, and instead we can use more exploratory and less pressure tense type movements in order to get things off. So really for hygiene, it's about using mechanized scaling. Because of our pandemic thingy that we're going through, that's been a struggle. Thank goodness there are now several forms of high volume evacuation systems out there to help us to get through that and get back to mechanized scaling. But interestingly enough, doctors go through this problem too. I actually had right after that post, I had a doctor contact me because he's having hand pain from gripping onto his handpiece too much, too tightly for too long a period of time. He had switched over to a smaller, more narrow handpiece. And so we thought, well, maybe that's the issue. Come to find out, it was his gloves. The gloves were too tight. So it's very interesting. You know, as a hygienist, a lot of us are kind of detectives in a lot of ways, because our job is to explore and find things in the mouth that are not normal, and make sure that we give the doctor an opportunity to diagnose those things. So that's my hard wiring, is being a detective, and it really flows quite easily into this ergonomics aspect. So when I'm talking to a doctor or a hygienist and they're saying, my hand is cramping or my hand is hurting, I've noticed this and I think it's my handpiece, it's more about asking all of the other questions that might have something to do with it. And it was just as simple, we need to change your glove size. Go up half a size. Make sure that your gloves are not ambidextrous, that they have texture to them, that they're, you know, that they're not too tight. So it's so multifactorial in nature. And that's where we have to think about, okay, can you feel your muscles straining against the glove when you're holding onto your instrument? Because when we have a loose, relaxed hand, and you put a glove on, you're not necessarily going to feel any tension. But as soon as you do this and you flex your hands, all of a sudden the whole thing gets tight. That glove might be too tight for you. So it might be time to move up a size or half a size.
And who would have thought something as simple as a glove would have been the culprit in this case, right? And I mean, who pays attention to that level of detail when ordering gloves? Other
Yeah,
than you.
just me.
Just you. Well, maybe now this particular dentist will, and maybe like maybe some people that are experiencing hand issues themselves after listening to this might sort of scratch their chins a little bit and wonder, could that be my problem?
Right. Yes, because if you're doing all of the other things right, then what else could it be? So, in hand strain comes just like any other kind of fatigue. A muscle is contracting for too long a period of time, whether it be the eye muscles or the back muscles or the neck muscles or any other thing. There's a contraction period that only goes for so long, and then the body gets to failure. So, and when you bring it back to like the exercise part of it, that makes a lot of sense, but we don't think about our hands getting tired in that fashion. But when they're fighting a glove for an hour, that's a long time. so
Yeah.
so they're done contracting. Thank you very much. I need a break.
Yeah. Well, I mean, I just listened to this and I think back to days in my previous life when I was practicing law, and I had issues where I'd be dealing with workers' compensation claims from people working in construction, experiencing repetitive stress syndrome, often from the fact that they would be having to hold on to these much larger pieces of equipment, granted. So the degree of violent repercussion, if you will, probably was significantly higher, but it's still that idea that you're holding on to a piece of equipment that's vibrating all day. That's your job for 7, 8, 9, 10 hours, however long you're working, however many days a week. Is it any wonder that they would wind up in a lot of them in a short period of time saying, I just can't grip anything, like I drop coffee mugs now?
Right. Well, OSHA will tell you that one of the 5 major risk factors for an MSD is vibration. And that's a concern for hygienists because our mechanized scaling that I'm so heavily saying, please do, it vibrates all day long. Our handpieces vibrate, but there's a certain amount of risk benefit analysis. If you have vibration that's going to cause a little bit of strain versus having to do heavy duty scaling with a death grip on an instrument, that's a lot more damage. So you kind of have to decide, pick your poison, which one's going to be less impactful and straining. And then the other thing is this, and I would probably vouch to say that there are very few construction workers that go around stretching their hands back out, and doing stretches. And I find that it's kind of similar for dental professionals. I mean, how often do we stretch our bodies? And that's something else that I stress in my lectures, and when I do an assessment, I always bring a sheet of stretches to do throughout the day in the workplace. Also, my clients that I do personal training with, they get stretches that are specific to them and their needs. So it's very much strengthening, stretching, recovering, and then practicing correctly.
Yeah. I mean, we're just scratching the surface on this topic, and I could go on, and I'm sure you could for like hours.
Yeah.
But this is called Quick Hits for a reason. I want to make sure that people can get some useful information in a short, digestible chunk. And we're actually at 16 minutes. I've broken my rule and gone a little bit over, but the topic was just way too fascinating for me to cut short. So, Katrina, if people did want to reach out to you with any questions, what's the best way to get a hold of you?
They can contact me via instant messenger on Facebook or on Instagram at ergofitlife_Katrina. They can go to my website, which is ergofitlife.com, or my email is ergofitlife@gmail.com. If you look up ErgoFitLife, you'll find me one way or another.
So there you go, all my Canadian dental colleagues. This is the best way of, given the pandemic thingy, that I could do to bring Katrina up to Canada for you and the wealth of knowledge that she provides. I don't think this is going to be the last time we're chatting because there's just so much more that I think is beneficial that Katrina can share. It would be great someday to bring her up to Canada. I'm sure, being a California girl, she would absolutely love to come up in February and experience a good Canadian winter.
Yes, please. That would be fun.
Lots of cold and snow, just what a California girl likes, right?
It'll make me appreciate home more.
Okay, so we'll definitely make sure that we bring Katrina back for another time, because I think this is definitely topics and subject matter that is vital for the dental community to know. And I just don't think we get enough of it up here. So Katrina, thanks very much for your time. I really appreciate your being here with us today.
Yeah, thank you so much. I appreciate the offer, and I'd love to come back and talk again.
Great. All right, everyone. Thanks so much for joining us. Until next time, we'll see you here on Quick Hits.